Movement is medicine, and your body is the perfect laboratory for healing. Sometimes it just takes one morning to realize that getting up isn't as easy as it used to be. Every step is heavy, your knee is swollen and stiff, and you start to dread moving. But I want you to know, it's not the end. I'm Dr. Noah Jupe, a physiotherapist in the UK, and in this video series, I'll show you how to remove excess fluid, reduce inflammation, and restore your knee with simple movements. No pills, no injections, just your body learning to heal itself. If you've ever thought, it's too late to recover, it's time to make a change. I am Dr. Noah Jupe, a physiotherapist working at a rehabilitation center in Surrey, England. Every morning, I meet people with the same concern: they can no longer walk the way they used to. Not because of old age, but because their knees have started to give them up. Some come with a cane, others hold on to the banisters as they climb the stairs, and they all say the same thing.
I just want to walk normally again, doctor.
Today's story begins with Mr. Bernard, a 8-year-old former carpenter. He used to stand for hours working with wood, but one morning, when he got out of bed, his knee was swollen to the size of an apple. Every time he moved, he felt like something was stuck between the joints, making every step difficult. When he came to see me, he said,
I tried painkillers, ice packs, rest, but nothing changed.
in fact, too much rest, which made his condition worse. In older people, when we stop moving, blood and fluid in the joints no longer circulate properly. The synovial fluid, which should lubricate and nourish the cartilage, begins to stagnate, putting pressure inside the joint and create inflammation, painful swelling. Many people think that to cure inflammation, they should lie still. But science has proven the opposite. When we move properly, the muscle groups around the knee, especially the quadriceps and calf muscles, act as a natural pump, helping excess fluid to be pushed back into the circulatory system, thereby reduce pressure inside the joint. Not only that, each time the muscle contracts, it also helps nourish cartilage. Because cartilage has no blood vessels of its own, it lives off the synovial fluid that moves around it. So, if you're living with swollen, heavy, or stiff knees every morning, it's not just age that's the problem. It's your body's reminder that it's time to activate one's own self-healing mechanism. I often tell my patients,
You don't need magic pills. Just relearn how your body used to work.
From there, I started to guide Mr. Bernard. 5 simple exercises can be done completely at home, no equipment, no pain, and takes no more than 15 minutes a day. After just a few sessions, he told me his knees were lighter, he had less creaking when he walked, and most importantly,
He began to believe that he could recover.
I want you to imagine this. Inside your knee joint is a closed system like a small bag containing liquid. When you move, the pressure inside changes, pushing fluid in and out to help lubricate the cartilage surface. But if you sit for too long or stop moving because you fear pain, that mechanism stops. Fluid begins to accumulate like stagnant water in a pond that can't drain. That's when you feel swelling, stiffness, and pain. The good news is, you fully reversible that. Through controlled movements, we reteach the body how to circulate synovial fluid, while at the same time strengthen the muscles around the nido, protect and reduce the load on the joint. It is the foundation of every modern rehabilitation program in the UK. When you understand the real cause, treatment becomes much easier. You no longer have to rely on drugs or wait for miracles from doctors. Instead, you become the driver of your own recovery. Like Mr. Bernard, who thought he would never climb stairs again, now he can take a walk with his wife every morning, thanks to move properly and regularly. Right now, I will show you first exercise, which helps reduce swelling and remove excess fluid from the knee joint. So simple, you can do it in bed. But before we get to the practical part, remember, movement is medicine, and your body is the perfect laboratory for healing. If you want to continue following these detailed and effective instructions, please follow, comment, and subscribe to the channel. Who wants to know more, leave comment number 1, because in the next part, I will guide you how activates the natural circulation pump of the legs, the first step to relieving pain and easing knee pain. Now, I want to guide you through the first exercise, which I call natural circulation pump of the legs. This is the simplest way to start your journey to reducing inflammation, clearing out synovial fluid, and restoring flexibility. This exercise requires no equipment, just a chair or the edge of your bed, and most importantly, you have to feel the flow of your body. Imagine you are lying on your back, in bed, with your legs propped up on a chair so that your knees are slightly higher than your heart. This position helps gravity aids in the drainage of synovial fluid, instead of letting them pool around your knees. Start by gently bending your feet toward you, then straighten them. Do it slowly, without rushing, as if you are reawakening the flow inside your legs. Every time you pull your foot toward you, the muscles in your calf, called the gastrocnemius and soleus muscles, will shrink. They act as a biological pump, push excess blood and fluid back into the heart, while also helping to reduce pressure on the knee joint. You don't need to lift your leg high or strain. Just do it rhythmically. Inhale deeply when pulling back, exhale when stretching. I once taught this exercise to a patient named Mrs. Margaret, 72 years old, had to use a cane for 3 years. On the first day of practice, she said, "I don't feel anything, doctor." I smiled and said, "It's okay. Your body just needs time to remember its rhythm." 3 days later, she walked into the clinic with a big smile, saying her legs felt warmer and lighter. That was when her body began to self-regulate the natural drainage mechanism, a miracle but true in physical therapy recovery. If you do it right, you should feel a warmth spreading from your calves up your thighs, as if your blood vessels are dilating. That's a very good sign. Please do about 2-5 times for each leg. Rest for a few seconds between sets. If you feel a slight fatigue or tingling, that means your muscles are working properly. And if your knee starts to feel better, lighter, congratulations. The recovery process has begun. This little exercise not only helps reduce swelling, but also improves venous circulation and lymphatic system, two systems responsible for removing excess fluid from the joints. In older people, this system often slows down due to lack of movement. Therefore, instead of using diuretics or joint injections, activating the muscles naturally with exercises like this is the way to go. Safest and most long-lasting therapy. When I was teaching in London, many people asked me, "Doctor, are there any exercises that can quickly relieve knee inflammation?" My answer is always, nothing is faster than patience. We spend months, even years, breaking down our bodies, and it takes time for them to get back into rhythm. But the amazing thing is, from the very first day you start moving, the body has recognized that effort. You don't see results right away, but internally, your tissues, muscles, and blood vessels have already started to talk to each other again. So I encourage you to practice this natural circulation pump exercise every morning and every evening. It's gentle, painless, and completely suitable for all ages. After a week, most of my patients notice a significant reduction in knee swelling, less morning stiffness, and most importantly, they regain belief that his knee could still recover. Right now, I will share with you second exercise. Help opens the knee joint and improves flexion and extension without pain. This is the crucial step that takes you from reducing swelling to increasing flexibility, and it only takes a few minutes to do. If you find this content useful, please follow, comment, and subscribe to the channel. Who wants to know more? Leave comment number 1. Because right now, I'm going to show you how knee joint stretching, according to British Standard Physiotherapy method, helps the flow of fluid and eliminates the feeling of heaviness in every step. Now, I want to guide you through the second exercise, controlled knee stretching, a simple yet extremely effective method to help joints regain flexibility without creating additional pressure or pain. To get started, all you need is a mat or a flat bed. Lie on your back with one leg slightly bent and the other leg extended straight up toward the ceiling. Using your hands or a long towel wrapped around the back of your thigh, gently pull your leg toward you until you feel a slight stretch in the back of your thigh. Hold for a few seconds, then release. The most important thing is never push your body beyond its limits. This isn't a flexibility contest. It's a way to help your body remember how to move naturally. When you do this move, the whole posterior chain, the hamstrings, calves, and muscles around the knee joint are activated. These muscle groups act like a zipper system that stabilizes the joint. When they stretch properly, pressure in the joint is reduced. The joint fluid is evenly distributed, thanks to which pain and swelling also begin to decrease. I used to teach this exercise to Mr. Charles, a London taxi driver. After years of sitting for hours every day, his knees became stiff and swollen. He told me, "I felt like my knee was stuck. Like if I bent it, it would break. We started with exactly this exercise, just 10 gentle stretches on each side. 3 weeks later, he could go up and down stairs without that stuck feeling anymore. As the joint fluid circulates, so do the surrounding muscles and ligaments. They regain natural elasticity, like a re-greased hinge. If you practice regularly, you will feel a very real change. Your knees less heavy, less rattling, and when you stand up, you will no longer have that stuck feeling. Do this. Number 10 to 15 times for each side. Inhale deeply when pulling, exhale when releasing. Between reps, relax your whole body, letting it adjust itself. Here's the interesting thing. When you stretch your muscles this way, you also stimulates the sensory nervous system around the joint, which helps the brain recognize the exact position of the knee. This is called proprioception, extremely important factor in motor recovery and preventing re-injury. I always tell my patients, the most effective exercise is not the most difficult, but the one you can do consistently. Consistency is the most powerful medicine. Even if you only do 10 minutes a day, it is better than doing nothing for months. The body does not need perfection. It needs signal that you are still interested in it. And as you start moving gently, small changes occur. Blood circulation improves. Soft tissues become more flexible. Joint fluid is redistributed evenly, and gradually, your knees start to breathe again. Remember, every move you make today is an investment in your future. Don't be afraid if your knees feel a little tired or tight. It's a sign of recovery. The only thing you need to avoid is sharp pain, because it is a warning that you are going over the limit. This joint stretching exercise is the foundation before moving on to the next stage. Quadriceps muscle activation, the most important muscle group in stabilizing and protecting the knee. When this muscle group is strong enough, you will not only reduce swelling, but also prevent fluid from accumulating again. And that, for me, was the real turning point in my motor recovery. If you find this story helpful, please follow, comment, and subscribe to the channel. Who wants to know more? Leave comment number 1, because right now, I will guide you how to safely activate your quadriceps so you can walk more lightly and confidently every day. Now, we will come to the third exercise, quadriceps activation, the strongest muscle group and also the natural shield of the knee. If these muscles are weak, all the force on the joint will not be properly dispersed, causing the joint to bear all the pressure, thereby causing swelling, pain, and recurrent inflammation. This exercise can be done anywhere, in bed, on the floor, or even while you're watching TV. Straighten one leg and place a small, folded towel under your knee. Then, gently press your knee down into the towel as if you're trying to flatten it. Hold for 5 seconds, then slowly release. At first glance, this exercise may seem simple, but in rehabilitative medicine, it is called a symmetric contraction method to help activate muscles without moving joints. This is especially important when the knee is inflamed or swollen, as it allows for increased strength without causing further damage. As you press your knee down, imagine your thigh muscles as a taut rope, tightening to protect the joint. Keep breathing deeply and evenly. Inhale as you prepare. Exhale as you press your knee down. Repeat for about 10 times for each side. Rest for a few seconds between sets. After a few days, you will feel the surface of your thighs become firmer, and the feeling of heavy knees will also start to decrease. I remember there was a patient named Mr. Thomas, 64 years old, retired teacher. He used to have joint injections every year to relieve the pain, until I taught him this exercise. After 3 weeks, he said, "Doctor, I can't believe that just one simple movement can make me stand up so easily." I smiled and said, "Nothing miraculous, just your body thanking you for letting it work again." It's the truth. Muscles are the joint's faithful friends. And when you give them a chance to work, they take the load off your joints. If you want to increase the effectiveness, you can put a small bag of rice or a light weight on your thighs to create a little more pressure. But remember, never to the point of pain. The goal is activate, not forced. After each workout, you can gently rub around the joints with both palms to help blood circulation better. Once your quadriceps are working properly, you will notice that you stand up and sit down easier, go up the stairs easier, and walk more confidently. For many people, this is the moment they realize, Oh, I'm actually recovering. I want you to remember one thing. No knee is too old to improve. There are only bodies that have forgotten how to move. When you exercise regularly, your blood, joint fluid, nerves, muscles all work together, and it is that coordination that makes you real medicine. Do these 3 exercises every day. Not only will you reduce swelling, but you will also prevent fluid from accumulating again, while strengthening the muscles and ligaments around the joints. And most importantly, you'll regain the belief that the body can still recover, regardless of age. If you find this content useful, don't forget to follow, comment, and subscribe to the channel. Who wants to know more? Leave comment number 1, because in the next video I will reveal to you how to restore hip and lower back strength, 2 areas that play a vital role in reducing pressure on the knees and maintaining stable balance in middle age. Thank you for following along to the end of today's journey. I am Dr. Noah Jupe, and I hope that every morning when you wake up, your knees are no longer a worry but a companion on every step of the way ahead.